Nadira. She's the founder and CEO of Kiddocare. Welcome everyone to this webinar on vaccinated adult, unvaccinated children. Should you send your children back to school? With us tonight is Professor Dr. Dayang Anita Abdul Aziz, who is presently the director of Tun Fatimah Hashim Women's Leadership Centre at University Kebangsaan Malaysia. She is the first women professor in pediatric surgery in Malaysia. She is also the first woman lead pediatric surgery services in an academic institution in Malaysia, being head of pediatric surgery at UKM's Faculty of Medicine from 2011 till 2019. Welcome and thank you, Dr. Dayang, for joining us this evening. So tonight, our session will be conducted in both English and also Bahasa Melayu. Okay, let's start ya.
Thank you, Wahaini.
Dr. Dayang, seperti yang kita ketahui, Kementerian Pendidikan telah membuat keputusan untuk membuka sekolah pada 1 September secara berperingkat. Walau bagaimanapun, bilangan kes COVID-19 dalam negara kini adalah pada tahap yang paling tinggi pernah direkodkan. So, among my friends and people that I know, ada dua pendapat tentang pembukaan sekolah ni. Satu golongan, ibu bapa yang memang ingin sekolah dibuka secepat mungkin. For example, parents who are frontliners, who do not have a support system, parents yang memang cannot handle PDPR, they just cannot handle the online lessons. And also parents who are concerned about kids lacking in studies, critical thinking, social, emotional skills and physical development. Ada lagi satu golongan ibu bapa yang memang tidak setuju jika sekolah dibuka kerana mereka risau anak-anak akan terdedah kepada risiko jangkitan COVID-19. So tonight we'll be discussing about this, yeah. So if we do decide to send our children to school, what can we do to minimize their exposure to COVID-19 and how we can help them to strengthen their immune system? Okay, hari tu kita dah hantar survey to our participants, okay? And I've gathered some of the questions here. So we'll start with the first question, yeah, Dr. Dayang. We know that one of the ministry's decisions for school reopening will be dependent on full vaccination of the adults in the school ecosystem. But then they could still infect our children. In your personal opinion, what would be the most ideal conditions for reopening of schools? What should be in place? Silakan.
Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera kepada Petu Muhaini, Nadira, dan semua yang ibu bapa atau rakan-rakan yang mengambil masa untuk bersama kita pada malam ni ya. I feel very honoured. Thank you for the kind introduction. Muhaini bagi soalan susah. Saya berpendapat untuk kita menjawab soalan tu, kita boleh kongsi beberapa strategi. Okay? Ideal tak nak buka masa kes tinggi ni? Ya, tentu jawapannya untuk kawasan yang tengah tinggi ini tak sesuai lah ya. Tetapi ada beberapa faktor ataupun data, kalau ada data-data ni mungkin Kementerian Pendidikan Malaysia KPM dapat strategis lebih baik lagi ya. Itu pendapat saya lah. Sebab saya tak berasa kita boleh top down kan semua benda, terutama untuk sekolah ya. Kita tak boleh mesti start semua orang 1 bulan September berperingkat. Apa maksud berperingkat tu tak berapa clear kan? Jadi tujuan saya pada malam ni, saya nak supaya kita sama-sama ibu bapa dengan cikgu sama-sama assist one another and in the process mungkin membantu sekolah, membantu kerajaan juga Sebab kita mesti jadi rakyat yang participate dalam menghadapi keadaan pandemik ni. Tak boleh kita tunggu passively apa kerajaan nak suruh kita. Kita tak boleh macam tu because it's a pandemic. So it's good that everybody join this evening nak raise concern, nak share opinion dan sebagainya. Pada pendapat saya, pertamanya ada data-data yang patutnya diberikan oleh kerajaan untuk membantu kita stratify situasi COVID kepada kanak-kanak. Nah, kalau kita tengok data yang sedia ada ni, yang saya tahulah up to Jun 2021 saja, yang mana diberi jumlah pesakit COVID kanak-kanak mengikut umur kurang 4 tahun, kemudian saya preschoolers, kemudian up to 12 years old, kemudian sekolah menengah, which is good. Tetapi jumlah saja tak mencukupi, Muhaini. Kita kena tahu pesakit tu di kategori mana? Kategori 1, 2, 3, 4, 5, apa comorbidity yang ada pada pesakit-pesakit itu. Jadi kalau kita tengok sekarang ni beribu-ribu, tapi saya tak tahu, saya sendiri tak tahu berapa yang daripada setiap hari yang beribu-ribu tu, berapa kanak-kanak dan berapa age group yang terlibat. So first thing first, kita kena ada panduan burden of disease tu untuk kategori preschoolers ke, sekolah rendah ke, sekolah menengah rendah ke, atau sekolah menengah form 4, form 5. Sebabnya kalau kita tak tahu burden of disease, kita tak tahu macam mana nak menanganinya. Kalau data tu menunjukkan tinggi kepada preschoolers, sebelum sekolah buka lagi preschoolers dah banyak. Kena katakan. Dan kategori mereka adalah 3, 4 ke, saya tak tahu. Jadi tentulah kita tak buka ataupun kita lessen opening untuk kategori itu. Dan kita tengok pada comorbidity dan sebagainya. Begitu juga untuk negeri-negeri. Jadi mungkin negeri-negeri yang kurang, yang dah hijau, kan, ada kemungkinan mereka lah yang negeri yang paling sesuai sekali untuk buka sekolah. Di samping itu, data-data ini juga kita kena padankan dengan kemampuan sistem kesihatan. Tentu ibu bapa yang saya pun sebagai pengamal perubatan, walaupun at the moment kerja-kerja perubatan saya terhentilah, tak ada kes elektif dan sebagainya, kita bagi priority kepada kes-kes acute saja. Tentu kita nak tahu adakah sistem kesihatan kita boleh menangani, katakan kita buka sekolah betul ada outbreak, kan? Tentu kita nak tahu ada kepersediaan sistem kesihatan yang di dalam negeri itu ataupun dalam wilayah persekutuan, katakan mencukupi tak hospital-hospital ke, para-para doktor ke, bersedia tak? So ini adalah data-data yang saya rasa kalau kita nak supaya rakyat menjadi selesa lah nak hantar anak ke sekolah dan sebagainya, itu satu, itu satu point ini. And pada saya, preparedness sangat penting. Preparedness on the part of the family, preparedness on the part of the school, preparedness on the part of the teachers. Jadi masalahnya kita tak pernah bincang benda ni sebelum ni, kan? Dan nak buka sekolah ni baru kita macam nak adakan benda ni. Katakan daripada tahun lepas kita dah berbincang tentang ni, tentu kita ada banyak data untuk bantu kita, kan? But it's not too late. It's not too late, okay? Besok pun kita dah boleh start apa-apa nak preparedness. Saya nak sentuh sikit ni preparedness pada ibu bapa contohnya, kan? Ibu bapa boleh bantu cikgu-cikgu, sekolah-sekolah, tengok preparedness anak dia. Bukan saja preparedness dia teringin nak hantar anak pergi sekolah untuk nak dia frontliners dan sebagainya. Nak tengok preparedness anak tu sendiri. Dari aspek kesihatan anak, dari aspek kesihatan fizikal dan mental. So what I'm trying to say is that ada tak kita ibu bapa tengok kesihatan mental dan fizikal anak. Adakah anak ni sepanjang PKP dia menjadi obes ke, ya, menjadi lebih kurus ke, lebih senang dapat alergi ke, ya. Daya ketahanan badan tu mesti diketahui. Ibu bapa is the best lah, atau penjaga, ya, penjaga pada anak ni. Bagaimana keadaan emosi anak ini, ya. Jadi ibu bapa boleh bagi input kepada sekolah sama ada anak dia ni ada tanda-tanda stres ke, ya? Because we know kalau majority ada anak-anak, ada tak orang buat survey untuk anak-anak sendiri, are they happy to go to school? Mak aja happy, ayah aja happy, anak tak happy nak pergi sekolah, because we cannot assume children will respond. Macam saya cakap tadi, jangan buat dah top down kita force them to do it. Because pandemic, stress is bad. So highlight anak ni ada ke ciri-ciri stress, apakah gejala-gejala stres yang kita boleh dapat pada anak-anak. Sama ada dia ada headache ke, abdominal pain, ya, adakah dia boleh tidur malam dengan bagus, adakah dia menangis, ya, adakah ada kematian dalam keluarga, kematian sebab COVID, anak jadi takut, So ibu bapa boleh ambil point ni untuk anak masing-masing dan share dengan pihak guru, ya. Preparedness itu preparedness ibu bapa. Then of course parents needs to make sure they are vaccinated. Okay, they are vaccinated. Abang-abang dia yang lebih tua tu vaccinated. Dan nak macam mana nak pergi sekolah. Jadi sebenarnya saya dapati tidak ada, mungkin saya silap, tapi saya pun dah tanya rakan-rakan yang ada anak-anak pergi sekolah ni kan. Tidak ada perbincangan. What is the expectation untuk pergi sekolah ni? Sebab pada saya expectation untuk pergi sekolah tu penting. Kita tak boleh dah expect anak pergi sekolah hari-hari. Okay? And cannot satu kelas 30 orang kan? Kita tak boleh macam tu kan? And then tak boleh kita harap after 2-3 classes break beberapa minit, everybody rush makan and then come back and we finish macam biasa. Sebab kita kena ada penjarakan dan mungkin kita kena terima setiap anak murid tu tidak boleh pergi ke sekolah lebih pada 2 kali seminggu. It's a start, okay? But we have to do it because we cannot not open the school. It's not healthy. It's not healthy for the child because social skill ni sangat penting. Kita asyik fikir kita je tak boleh begitu ya. There's some parents yang berasa ya anak kena pergi sekolah. But these are gradual. You have to do it gradually. Di pihak sekolah pula sebagai cikgu, katakan saya sebagai cikgu, saya boleh merancang. Saya boleh dengan rakan-rakan merancang, dengan ibu bapa merancang berapa orang anak murid yang saya boleh ada dalam kelas. Jadi kalau saya seorang cikgu, saya nak tahu sama ada anak murid saya ni berapa orang yang sihat tak sihat. Berapa orang yang pernah kena COVID, tak pernah kena COVID. Berapa orang yang ibu bapa mereka pernah kena COVID, ada kematian COVID ke? Ya? Adakah orang yang menjaga anak ni dengan baik? Bagaimana status kesihatan dia? Apa illness yang dia ada? Stage illness dia macam mana? Ya? Jadi sebagai cikgu saya nak tahu tu. Dan cikgu juga kita kena faham they have to be look after as well. Ya? Jadi berapa sebenarnya jumlah guru yang sekolah tu boleh spare? Okay? Adakah guru pun terlibat sama kena COVID and seterusnya, ya? Itu tak termasuk lagi penjarakan kan. Jadi saya rasa ada banyak lagi detailnya Muhaini yang kita tak boleh just out of the blue kita kata okay we open the school on 1st September unless we address concern by parents, ya. I know some school are quite good. They already share with parents. Okay, contohnya we are not going to of course no assembly kan. Jadi sampai sekolah maybe kita kena stagger time bila nak ambil their temperature. Boleh ke cikgu mengajar berjam-jam pakai double mask ni? Before this hanya nurses, doctors do that. We are used to wearing double mask and working, you see, dengan face dengan face shieldnya. Can the teacher cope with that? Okay, so I think there are many things to consider before we can say ideally there is a deadline, everybody must go and open the school. Itu saya punya preamble lah mau ini.
Okay, Doctor, if you don't mind, we've been receiving quite a number of questions from our participants today. I think rata-rata memang banyak parents rasa stres ni, bukan setakat parents stres, parents pun tahu anak stres pasal kena duduk kat rumah. They are aware that, parents are aware that the children have to be in school. But, I think there's so much fear. Fear tu datang daripada, anak tu pergi sekolah, bawa balik pula dekat rumah. Will it be okay? Will it be safe for other people in the house, right? And then, so I want to take up one question from one of our participants. I think this is probably something relatable to many people. So one of the question dekat sini ada dia mengatakan, okay, so I'm going to read out the question. So we have a 9-year-old daughter. My husband and I are both fully vaccinated. My parents live 10 kilometers away and we are both, and they are both vaccinated as well. We have not visited my parents since Ramadan and we miss them dearly. Is it safe for my parents to visit us at home since we are fully vaccinated? How can we make sure that it is safe for our daughter? I think rata-rata soalan macam ni, dah vaccinated adults ni, but the impact on the child. So if you bring somebody in, how does that work, Doctor, if you don't mind?
This is a very difficult question because we have been telling everybody stay home. Okay, especially now we said the Delta variant is very rampant. You don't need 15 minutes. You need few minutes saja. Okay, and then with the current data or knowledge, we know the double dose cannot really protect you 100%. In fact, to be honest with you, no vaccine can protect you 100%. Okay, in our process to say there is a Delta variant, now worldwide we know there are Lambda variant and more variants. Okay, but how to answer the question, is it safe for grandparents who live nearby to come and see the granddaughter? Yeah, I can feel the anguish. No video call will be adequate. In the current situation, if you are in a red zone, don't go out. That's my advice. Okay, but if you are in a state or in a neighborhood ataupun kawasan sekeliling you is not red, okay, all are vaccinated, you may visit with precaution. Okay, so of course you can see parents semua nak keselamatan anak sebenarnya, especially less than 12 years old, memang there's no vaccine. So sometimes we have to depend on how other countries do it. Okay, but of course it's not, we cannot say it will be the effect will be mirrored totally in our situation, kan? But I think at some point we have to live with this COVID. It's not going to go away. Yeah. So the best, although we are vaccinated, is the universal precaution, as we said it. Yeah? We have to live with distancing. We have to live with washing our hands and sanitizing our hands. We have to live with wearing mask all the time. Yeah. Jadi kalau mungkin atuk dan nenek dah vaccinate, ya. For the sake of the child, anak tak vaksin, kita nak protect the child, ya. But we never know if the child carries other variant that will be harmful to the elderly. Okay. So that's why kita kata masa-masa COVID ni, we cannot just think about us. We have to think about our neighbors, our family members, yeah. And it's really, you can see, I'm sorry to say this, but it's just not possible for many families to do proper home quarantine, kan? Kita cakap senang, duduk dalam bilik, bagi makanan. Tapi apabila the mother is affected, that's it. Kita tak ada bantuan lain. for that family, kan? Which is not right either, yeah. Okay. Sama juga bila kita kata kita kontrol situasi dalam rumah, kita ibu bapa kita yang lebih elderly mungkin dah vaccinated, but there is no guarantee they will not get a COVID infection. The vaccine may help to lessen the severity of the COVID infection. But that also depends on the type of variant that you get, kan? And at the moment, the assumption is Delta because that's easily transmissible. Tapi kita tidaklah. I'm sure everybody knows this. Nak cari variant Delta tu, Nadira, is not cheap. It costs a few thousand untuk dapatkan variant. Jadi kita lebih mengambil kira berhati-hatilah. This may be variant Delta variant. Okay? Jadi itu jawapan saya. Saya harap dia menjawab lah. So it's not the answer that you want probably, but something for you to think about sebelum kita allow berjumpa orang tua dengan anak-anak because the anak-anak may not be so affected, you know. Yeah.
But I guess what I can make out of your thoughts just now, whether you like it or not, we're going to be living with COVID. So you suggested, to have that kind of universal precaution.
Yes,
kan?
yes.
Dia sama ada kita keluar ataupun orang masuk rumah kita, there is definitely that level of risk, right?
Yes.
That level of risk. You have to. I think this is one when. That data, knowing the effects, the the burden of the disease, that the first point that you made just now is very important. So at least knowing the kind of risk, then you can mitigate better, kot.
Yeah. Contohnya orang nak datang rumah kita. Unfortunately sekarang ni kita kena tanyalah, you kawasan merah ke kawasan you it's nothing personal. It's just for safety. You ada sesama ke, batuk ke? Did you have fever? Is there anybody around you investigated for COVID or anybody? I mean, just ask a little bit more so that you don't make matter worse. And I don't think people will get upset kalau you ask those questions now. Dulu kalau orang datang rumah kita tanya macam tu, macam tak nak kasi datang rumah kan. But now kita tak ada choice. And kita tidaklah extreme sampai you kena check temperature kat dalam rumah tu. I think it's adequate kalau you tanya, you feel fever, you have sore throat, cough. And if you have a friend from macam kita doktor-doktor ni, janganlah kasih doktor-doktor kita ni balik, misi-misi ni balik, oh tak mandi lagi, nak pergi visit rumah. Oh, saya nak drop. No, it's a no. It's a flat no. Just say, I think you better jangan singgah kot. And kita pun sebenarnya frontliners, a lot of us, kita dah buat practice tu from last year lagi. Kita tahu bila sebelum masuk rumah pun kita dah mandi, sebelum balik rumah kita dah mandi dekat. Kita ada baju yang kita pakai dekat tempat kerja, baju yang kita guna dalam kereta, telekong pun begitu, everything kita dah buat and it become second nature to us. Yeah.
So I guess that new lifestyle tu dah memang
you have to do it.
Dah jadi normal lifestyle lah.
Yes.
Lifestyle dah jadi
tambah
normal
sini sikit kan, sebab kita tahu kan dulu kita punya lifestyle kalau cucu-cucu visit rumah tok-tok sampai-sampai dia semua terus salam, cium tangan, peluk semua kan. Sekarang ni kita kena tukar sikit lah kita punya lifestyle.
Yes, that's right.
Pun dia kena hantar emoji je lah, dia tak boleh cium physical dah.
Macam tu kan.
Kita kena berubah lah. Kita kena berubah lah.
Okay doktor, I ada lagi suatu soalan daripada participant kita tonight. I think this has something to do also with that first question, but maybe boleh in-depthkan lagi kot. So I'm going to take this one first before the earlier question. So a participant asked, tapi doktor dengan hari persekolahan yang hanya tinggal 8 minggu saja, bukankah lebih baik kalau terus PDPR sehingga habis persekolahan tahun ni? Kerana bayangkan sekiranya selepas sekolah dibuka, kemungkinan berlaku lagi kluster sekolah. So itu akan bukankah itu akan mengganggu emosi pelajar, tiba-tiba sekolah kena tutup balik, kan? So bagi dia rasa maybe this year settlekan vaksinasi guru, kaki tangan, pemandu van and everything lah. So kira the adult in school. Okay, I understand that this is also a way for a strategy to create some kind of a herd immunity within the adult population in school, right? So I nak jump into a second question pula. How can the herd community really protect our kids? So the first one is, do you think we should just teruskan aja lah PDPR sampai hujung tahun ni, because it will add more stress if kita masuk lepas tu sekolah kena tutup pula kan kepada budak-budak. And then number 2, strategi nak herd immunity within the adult community in school ni, how effective is it in protecting the kids?
Okay, kids are age 0 to 18 tau. So I'm trying to understand. I think you all are worried about the less than 12 years old lah. Sebab I think the government has asked children to be vaccinated from 15 September. Jadi kalau you nak tanya saya, my personal opinion, as I mentioned earlier, I need more reassurance. Okay. And I would err on the side of please give us all this information before there is a top-down decision to open the school. Okay, I think preparedness is very important. Terutama lagi, macam saya cakap tu, is the health system able to cope if there is an outbreak? Kita tak boleh, bukan kita bersangka buruk, tapi we have to be prepared because we don't want parents to, of course we don't want adult to perish also kan, but the burden on the child, saya tak boleh lah. Parents shouldn't be put in a situation where the kids become very sick and children expire. So I think there's a lot of question even from the health side that the government needs to be clarifying first. Okay, sebelum kita embark on this. And saya setuju dengan ibu bapa, para hadirin yang ask. I also don't know how many teachers in my school, in my child's school yang vaccinated. I think it's very important. Okay, are the teachers, how many teachers are available? Are they going to be stressed by it? So banyak lagi soalan-soalan ni Nadira yang tak terjawab. Jadi nak nak meet the deadline 1st September tu, it is macam short lah. Jadi I think it cause more anxiety to everybody. But again, percakapan kita hari ni, saya tak ada kabel dengan kementerian ke apa. Saya harap ada hadirin yang daripada kementerian lah. Saya did share this link with them. Bukan saya nak kata saya ni, but my forte could be probably is the strategy. And I think we need to taper it towards the community. Okay, the community that we are serving. Not so much top down because it's not going to work. Macam sekarang ni kita tahu yang dapat double dose ni boleh keluar sana keluar sini. I know it's economy, it's empathy. But at the different level kita kena hati-hati sebab there's variant and there's negara-negara yang dah double vaccinate getting a new outbreak kan, and everybody is scared again. Jadi kita kena berjaga-jaga. Dalam chat tu saya nampak dia sarankan kenapa bolehlah kita sambung. If it is my choice, is different. I really want to know the level of preparedness for the family, and then the preparedness for the school, and the preparedness on the government side. Okay, sebab saya pun terlibat juga kan. The bottom line is kita tak mau anak-anak ni kena COVID. Walaupun kita kata anak-anak ni bila dapat COVID dia supposedly mild. You know why? Because we hardly talk about this. But there is a post-COVID syndrome. Ataupun kita kata efek kesan selepas COVID. Boleh tanya semua adult yang dapat COVID ni. Macam mana dia? Dia punya breathing bukannya automatic balik rumah tu boleh sorted. My own staff anxiety very high. Level of anxiety very high. Dengar je kes dia panik tak boleh bekerja. They don't their immune system is not back to 100%. It take months. Okay. So kalau adult macam tu, imagine kalau children kena, we don't know the long term effect. So we cannot say macam like Ismail and because this is a pandemic, we don't know the cohort. Okay, so I think kalau saya nak a bit more depth from last year, what happened to the cases yang children yang diagnosed last year. Saya nak tahu. Okay, macam adult, kita tahu respiratory team, respiratory physician, dia buka special klinik dia untuk manage post-COVID patient ya. Untuk datang, bagi nasihat. Tapi saya tak hear that about pediatrics. I'm sure they do, tapi public tak tahu. Tapi I think we need to share what is being done. So kita tak boleh macam cakap okay anak dapat ni mild, that's it. Because we don't know kan, we don't know the long term effect ya. So I rasa tunjukkan kesungguhan untuk menjawab soalan-soalan yang menyebabkan anxiety semua pihak ni. Kita tak boleh just you have to do this and just follow. Itu.
Dr. Dayang?
Yes, Muaini.
Sorry Kui, nampaknya kita Muaini lepas session Dr. Dayang ni Kiddocare kena buat kerja lebih sikit lah, minta government release banyak sikit data untuk kita semua ni kan. I think with better information, with more transparent data, we should be able to then, make informed decisions kan. Sekarang ni, everyone is in the dark also lah. Come Mui, you have something to ask.
Yes, I do actually, Dr. Dayang. Okay, based on your experience, is there a need to assume the worst if our child start displaying symptoms like flu, fever, cough and all? Biasalah kadang-kadang, anak-anak kita ni dia bersin ke, batuk ke. Do we terus assume like dia ada COVID? Do we go to the what do we do? Sebab sekarang ni orang cakap tempat hospital dengan klinik ni risiko tinggi kan? Adalah orang cakap kalau boleh avoid lah. Kan? Banyak orang yang pergi for just simple surgery and then they end up dying because they contract COVID masa doing surgery yang not related. So what should parents do kalau anak tu dia display simptom macam ni?
Itu pasal
how do we tell the difference between normal flu, cough, fever?
We can, okay? It's a flu-like illness. COVID ni is a flu-like illness, okay? Tetapi ada certain symptom yang very characteristic of COVID. Contohnya dia tak boleh smell. They lost sense of smell. Jadi saya ingat masa tahun lepas masa baru-baru start COVID ni dulu, kita nak saring pesakit dekat klinik kan. So kita ada questionnaire demam, are you exposed, are you travel, macam tu kan. Tapi for children pun kita ada soalan bau. Macam mana kita tanya bau pada kanak-kanak? Kita tak payahlah nak tanya boleh bau ke tak. Kita just bagi botol yang ada oil ke something yang bau limau. Kita ada 2 bau. Almost every children kan, walaupun dia tak pernah makan strawberry, dia akan tahu bau strawberry. Very interesting and dia boleh kenal ini bau limau. Jadi kita bagi these two item untuk dia bau dan dia cakap boleh kita test masa tu. Dia I think kalau hilang kemampuan bau ataupun dalam bahasa medical ni anosmia kita kemungkinan lebih tinggi COVID and that is why I setuju dengan saranan kita ada self kit at home, testing kit, but it has to be affordable. Then if government really want to help, these are the things yang you kena bagi anak-anak atau from family and it has to be affordable for them. Sampai orang yang yang don't sideline B40s katakan so help them and then politician can do this because they know who are the ones who need it. Maybe tak bagi kat rumah letak macam tu, but when there is a need, there is a phone number they can call a group or the community leader ke go there and get them tested. The key is test them early. Jangan try nak assume this is Anak saya selalu dapat flu biasa, so this is another flu biasa. Di waktu pandemik ini, kita kena detect lebih segera. And the best is kalau, bukan the best lah, semua orang tak nak kena COVID is kalau kita didapati positif tanpa gejala, without symptoms, because I think then the chances are we can recover better, okay, with precaution and improving our immune system. I hope I answer your question, Maini.
Yes. What your advice? Is it better for them to go to like hospital or clinic? Kalau they show
Certainly
symptoms
not
like this.
hospital pun tak terima dah kes macam ni Maini,
tak terima dah.
unless there are certain hospital. That's why there was a webinar I did with Dr. Shira, in which I mentioned, and I hope this is taken up. I think public needs to know where are the non-COVID hospital. Dulu kita kata nak tahu mana COVID hospital. Now almost hospital are hybrid. Ada jaga COVID dengan non-COVID. Tapi kerajaan boleh bantu dengan openly bagi tahu ini adalah non-COVID hospital. Sebab
Do we have that data at the moment? Is it published?
Tidak. Jadi kita harapkan,
available.
saya punya saranan ialah teaching hospital become non-COVID
Saranan.
hospital. Sebabnya kita ada expertise di situ untuk pelbagai. Dan kita the non-COVID cases tak menurun tau. Masa COVID ni is the same. In fact, mental health problem is even higher. Non-COVID related anxiety, uncertainty among healthcare workers, among parents, public dan sebagainya. Jadi kalau tentu bila kita pergi ke Jabatan Kecemasan, kita tidak akan ditolak lah. I don't think there's any, memang mungkin nampak signage penuh kan sebagainya, tapi kita hospital tak pernah. Tapi selepas di Jabatan Kecemasan, pada triage dan bagi yang awal, public must know where to go. Kan? Jadi situasi sekarang ni, especially kepada kawasan-kawasan yang merah ni, kita kena ada cara pathway untuk bantu kita punya citizen lah. Satu saranan saya contohnya ialah gunakan GP keliling, GP private ataupun family physician lah. Family physician di private ataupun family physician di bawah Kementerian Kesihatan. Because I can tell you in this pandemic, nobody including myself, we don't want to be sick and then we are told you tolong jawab My Sejahtera saja. You want somebody to call. In fact, I think all doctors and nurses now we are managing friends and colleagues, sebab kita tak friends, colleague and family members kan, sebab kita tak sampai hati not answering their call for help. Okay? We all need to look out for each other kan? Yeah.
So Doctor, ada a few questions tadi. I wanted to comment on your suggestion. I think it is a good suggestion to have that kind of directory of non-COVID hospitals, the places where you can go and things like that, so that it be easier for parents to access lah kan, because sekarang ni satu hospital dah turn into COVID treatment hospital kan. Okay, so we'll see what we can also propose and suggest to relevant authorities, but maybe we can work with the likes of other startups like Doctor on Call and things like that yang boleh take part in this lah. Doctor, if you don't mind, I want to take up some other questions yang kita dapat di sini. I think this one is also a little related to soalan yang membawa ibu bapa dia masuk rumah tadi tu, ataupun bawa anak dia jumpa dengan ibu bapa kan. So many parents are actually toying around the ideas of instead of sending my child to school, why can I take a teacher or a nanny ke apa into my house, right? To help my child with homeschooling, homework and things like that. Because anak-anak pun dekat rumah pun macam mak kata Puan Erna dekat sini, my daughter is crying every day, nak teacher, dah refuse dah, dah nak somebody to come in and help her. So in the case where if we want to bring like a teacher into the house, right? Yes, there is certain kind of risk and things like that, knowing that, you know, the parents semua dah vaccinated, other adults are vaccinated, the teacher is vaccinated. What kind of SOP can we put in place so that we can create a safer environment for the child dekat rumah?
Itu macam soalan untuk kementerian kan? Homeschooler.
Harap-harap kementerian dengar lah.
Ya.
Okay lah.
Sama juga. I mean, it's a good idea sebab dia tak nak anak dia keluar. So dia nak cikgu datang. Okay, then address with the child. Is that what the child wants? Yeah, it could be something that the parents want. But a child is being a child. Yeah, maybe they find macam yang tu, ya, anak menangis nak cikgu. Atau ramai sebenarnya anak-anak yang menangis nak cikgu. That's why how influence cikgu-cikgu ni influencer sebenarnya kan. Yeah. The way they teach is different kan. And those must be child-friendly teachers, I can assure. That's why children loves them very much. Pasal homeschool ni, as far as I know, all homeschool teachers are also under KPM. And I'm sure they are standards that they have to meet. They have to meet to ensure that they are safe. Sama juga macam yang lain-lain. I think the teachers should be vaccinated. The teachers should go through a checklist, sama macam yang medical gunakan when you want to come to meet us kan, whether you have exposure, whether you are vaccinated, whether you have symptoms to suggest COVID, when was your last blah blah blah, banyak soalan lah, and then barulah dibenarkan orang tu masuk untuk mengajar, because of course bila kita mengajar dekat rumah pun, the area must be well ventilated. Sama macam kelas tadi lah, kita tak go through the physical structure, tapi it has to be a well ventilated place, the distance between the teacher and the students must be at least 2 meters apart, they must wear mask, they must wear face shield, okay. They must intermittently wash their hands, and perhaps it's better not to have long contact, because you never know, because yalah, mungkin hari ni dia negatif, and of course for me, bila kita buka pada sekolah-sekolah ni, pihak sekolah, guru sebenarnya boleh minta whether they should be screened regularly. Okay. Macam saya berasa pada peringkat awal ni, bila kita buat satu, kita buat lebih detail sikit, maybe kita kena check status cikgu, dan status murid mungkin, remember the teacher meets the student can also transmit to the teacher, and the teacher goes home, so it's everybody must look at the well-being of one another.
So what I can take from that is for the teacher or for somebody that you want to bring in, then probably, you know, to have a set of questions would be good lah. You tested negative, you bila apa.
It should be the same untuk pergi sekolah pun, Nadira, actually. So yang kat sekolah tu boleh gunakan di rumah kalau dia kementerian izinkan homeschooling lah, which I think is not a bad idea to ensure the parents can afford it and the situation allows it. Of course, again, it matters where you are. If you are in a red zone area, you don't go out lah. Saya pun tak. Sama juga orang tanya saya nak belajar mengaji sebelum ni. Jadi sebelum ni saya kata mengaji pakai Zoom lah. Kan? Jadi saya kata actually kalau saya bagi kita panggil insentif kepada parents untuk ada Zoom account. To be honest kan. So dia buat teaching lebih senang, boleh mengaji sama-sama kan, boleh tengok muka cikgu kan, dan sebagainya lah. So I think a little bit more Preparation kot Nadira sebelum kita
I think
allow.
on both sides lah, on the apa
Yes.
nama ni, educator punya side dan juga on the parent side, ada certain SOPs juga yang dia boleh buat dekat rumah dia lah.
That's right. That's right. Yeah.
So I think it's back to what you said, preparedness. Parents ada preparedness level, teacher, school ada, government pun ada. So in any situation, tiga-tiga tu kena bekerja sekali lah kot.
Yeah.
Ni ada lagi banyak soalan hari ni.
Before that, Dr. Dayang ada satu
Yeah.
ni.
Yes.
Okay. As you mentioned earlier, now hospitals memang full, the chances of you, getting admitted to the hospital now is quite low. Probably they will just take if you're really, really serious, cat 4, cat 3 and above, I'm assuming, yeah? Kalau category 1 and 2 tu, mostly they ask you to home quarantine. Okay, so can you give some advice for parents kalau anak, their children get COVID, and they're category 1 and 2, so they're home quarantine, can you advise what's the best way to protect the children, to minimize lah the seriousness of the symptoms, so that mereka takkan jadi lagi teruk? What can they do at home? What can they eat? What is good for them?
All
to
right.
strengthen their immune system if they were to home quarantine at home.
Generally untuk immune system anak-anak is balanced food kan. Children kita tak berapa suka bagi supplement, to be honest, So what are the diet yang kita nak? More green veggie, more fruits, But during the time dia dapat COVID, it is advisable for you to up your vitamin C supplement, vitamin D3, okay? And really make sure there is a balanced diet. Mungkin anak ni cakap senang, tapi I know budak-budak tak makan sayur, tak boleh tengok sayur, tak suka buah ni, anak tak suka buah ni. So this is the point where you may have to be a bit more strict, because at the moment tidak ada one single ubat yang sesuai untuk kanak-kanak. Even yang off label pun, yang kalau ada yang try off label use of medication for adult, di group of physician yang propose off label drug ni, dia untuk children dia kata best to just focus on the supplements. Okay, so although we are not big on giving supplements to children, saya ingat masa kecil-kecil dulu kan, mak saya setiap hari duduk suap satu sudu
Liver oil.
Scotch emulsion. Scotch liver kan. Okay, so tak ada dah kot sekarang ya. Why ni I'm not sure.
Macam ada.
Ada ataupun yang effervescent Henry suka pakai tolong
reduction.
Kan vitamin C So you up those vitamins and make sure the ventilation is good at home, and you really ask whether the child is at stress. I don't think I don't think we talk about stress on children enough. So you need to speak to the child, what's bothering them, and try and address and put aside some time of the day to talk to your children and find out whether they are stressed.
I think probably, Dr. Dayang, I think we probably need another session just to address stress in children.
But look at symptoms like not eating well.
How do we detect?
Some of the symptoms, dalam saya punya pengalaman, there are 3 symptoms, common symptoms, and that present a child in very stressful situation present to us. Headache, abdominal pain, constipation. Bahasa Melayu dia, sembelit, sakit perut dengan sakit kepala. Okay. Jadi ini 3 simptom yang kerap kita tengok. Kalau children don't lie, up to the age of 10 they don't lie. Lepas 10 years old dia ada tendency to lie. But dia bukan nak adakan gejala tu. It's not that they want to have that symptom, but it's their way of showing. So kita sebagai healthcare worker, sebagai pediatrician or pediatric surgeon ke, bila kita dapat symptom-symptom ni, kita go deep a little bit. What's bothering them? And at the moment, maybe this is not official, right? But you can tell sometimes when they have grandparents or saudara yang meninggal sebab COVID, ya, and the sight of seeing that burial yang quite dengan baju macam is traumatic for a child. And kita move on, tapi a child may be so traumatized, dia, you know, and can stress leads to infection. In adult is more common, but in children it can put their in a haywire state lah, a very unsettled state. Lepas tu nak introduce pergi sekolah lagi, so I think kita kena stratify preparedness of the child also.
Okay. Apa nama ni, Doktor, if you don't mind, I want to take questions from the participant hari ni, but I also want to apologize to those asking questions on PDPR and schooling. I think we will leave that for a different session, maybe with somebody from the education sector lah kot. Because in the interest of time, we want this to be more COVID-related question, kalau boleh ya. So participant, I'm sorry, we'll have to pick and choose the questions that we ask tonight. So Doktor, you tahu hari ni kita semua, parents yang dengan anak-anak dekat sekolah dah dapat memo. It says that the government is allowing vaccination for children 12 to 17 years old. So I think a lot of parents are also concerned. What are your thoughts about, giving vaccines to children below age of 18 ni?
It's inevitable. Okay. Really, it's inevitable, because it's a pandemic. Vaccines are not entirely 100% safe. We know that, and in children, we don't even know what is the long-term effect. Okay, macam saya, masa saya dapat Pfizer dulu pun macam kena force tau. Saya pun takut dengan mRNA macam ni kan. Tapi kita terpaksa sebab kalau doktor ni, Prof, you tak ambil, you tak boleh touch patient. Okay, so we took it. We took it. I got quite bad reaction after that, but okay, we took it because we weigh the risk and benefit. In medicine, that's what we do. We weigh the risk and benefit, and vaccination is very important in adult, very important in adult, and those children near adult. So I think the question about 16 to 17, go ahead. I think do it, do it, okay. But 12 to 16 ni, yang paling banyak vaksin, yang paling banyak tested and they look through at the complication is yang currently advised by the government. Okay, yang lain-lain tu kita tak tahu. Now, very important sebenarnya kalau kita tengok vaksin-vaksin lain kanak-kanak, vaksin, cara prepare vaksin ialah inactivated virus, inactivated organism. Okay, maksudnya kalau kita ikut tu Sinovac lah, Sinovac ni inactivated. Tak ada pun vaksin sebelum ni yang pakai mRNA macam yang Pfizer ni lah, Tapi Pfizer dia telah bagi banyak data bagaimana dia, and then dia bagi tahu ke kita apa komplikasi yang kita nak look at, so kita boleh bagi option tu kepada parents. I think that's what I think why the government choose to say give this, and then I must say I'm very I had a look already at the guideline for the COVID vaccination for children, and I'm very impressed with the team that come up with it. So itu mesti kawan-kawan saya jugalah tu di Kementerian Kesihatan, it's very nicely done. Kita punya concern semua dia address lah, and they are not afraid to say what complication, how do we stratify which student, which patient pediatric yang kita nak stratify, nak assess di hospital by the pediatrician to decide whether Pfizer is the right one or can we exchange to something else. So I like that. Jadi jawapan saya tu is inevitable. Nak achieve herd, and of course it's not foolproof kan, ada variant dan sebagainya. Sekarang ni pun kita yang dapat 2 dos ni ada, kita bincang nak kita bincang nak dapat the third dose. Personally, I don't think we need to chase variants, we need to also rely on our immune system, yeah, and we must practice this new lifestyle lah daripada kena, kan? That is more long lasting, I think. The adoption of new lifestyle lebih penting lagi. Jadi saranan untuk vaksin itu begitulah Nadira. Saya rasa that's my stand. Ya, kalau kan saya, but I must say I was quite impressed with the guideline that has come out, and I think parents should be allowed to look at the full guideline and ask question, and they must be puas hati lah, kan? Ya, kita tak boleh puas hati semua orang, tapi to the level yang apa persoalan, mungkin penulisan tu sesuai untuk doktor tapi tak sesuai untuk umum ke, dan maybe ada pediatrician yang pandai-pandai, boleh tengok apa surgeon ni cakap pasal vaksin. But you know, to the level that I can share with public so that they understand why there is a need to do this, yeah.
So doktor, you know, you were saying that, you know, vaksin ni sepatutnya dia inevitable lah, inevitable lah, pasal, you know, it basically just makes sense for you, the healthcare system, it reduces the stress on the system and things like that, right? Tapi doktor, ini mungkin we want your personal opinion lah, because this is a question that's asked by one of our participants also. Pasal kita ada golongan yang anti-vax, so dekat sekolah ni macam mana doktor? Kalau the adults tu, is it mandatory for the adults in the school? So cikgu lah, jaga kantin lah and all that. Is it mandatory for them to be vaccinated ataupun they must be?
Yes, okay.
Alright.
I said in pandemic, it's not about you. Okay, it's not about me. I don't like Pfizer, I'm getting Pfizer. Okay, I don't like to go to work in that situation. I have to. Okay. It's not my business to advise people, to counsel about anxiety and all, but I am doing it as a doctor because I know the feeling of being sick and you cannot go to the hospital. The government said, you know, you manage yourself. So I think we are the support system to one another. Yeah. And for the anti-vaxxers, please put that aside. Yeah, because please help the majority. Get all adults get vaccinated. Yeah, there are adult yang tak boleh vaccinate tau. Saya ada kawan-kawan yang ambil targeted therapy, they want to be vaccinated, but they cannot be vaccinated. So at the moment, actually the guideline ni bagus tau, sebab bila guideline children keluar, kita dapati tengok pediatrician, they are very detail, dia kata stratify what illness semua ni. Jadi kita dapati children yang dapat cancer, katakan in between, yang bila dia tak ada white cell count, dia tak rendah sangat, they are allowed to be vaccinated early. So we apply the same to adult. Sebelum ni adult don't take. So you see, this is a very liquid situation. Okay, what occurred 2 months ago, 3 months ago, last year, is unprecedented, and we must be able to change and not be so rigid. In medicine, never say never. Never say that's not the drug. We don't know. So when our colleagues say this may work, it's best to engage and discuss. So kalau kita tak suka vaksin kan, betul, then have a discussion and come to a positive ending to it. Yeah.
Doctor, you know, I've been reading the comments from our participant tonight. I just want to share for the benefit of all other attendees as well. So Puan Nur Fazilah ada cakap, kata anak dia 4 and 6 years old dapat COVID. So mula-mula tu dia demam 3 hari. Lepas habis demam, dia bawa pergi swab test dan it's positive, but both husband and wife were negative lah. They got it from Cikgu Taska. Okay. So just another sharing, I will lead to the question kejap lagi. Then we also have another participant who said that anak dia kena COVID 2 kali. Once in March and one in July. But Alhamdulillah dia tak ada simptom langsung. Tapi dia dah kena COVID 2 kali dah ni. So anak ni dia pula, dia dah boring dah duduk rumah. She really wants to go out. So, you know, one of the question is, now that she's gotten COVID twice, and she shows no symptom, right? Does that mean that it is okay for her? Will she be immune to it? Ataupun, will it get worse? And also, we have another question also pertaining to children yang dapat COVID ni. So the Puan Nur Azura tanya, do you have more info, on the symptoms that children kena ni, mild symptoms ni, and what's the worst that could happen to children? Or the worst ni only happen to children with certain conditions sahaja tak? Ataupun orang yang macam tak ada apa-apa tu boleh tiba-tiba jadi teruk? So
Okay. It's good question. Number one, I don't manage COVID patients. Okay, so the whole spectrum in the country I don't know. Okay, dulu masa arwah housemate saya ada, I'm always updated. Yeah, the COVID situation in the country. Okay, she was the head of Paediatric ICU for the country. Yeah, she meninggal for other reason. Yeah, in January. But before that, I'm always up to date and I see the spectrum. Yeah, so some children memang yang datang hospital ni they are ill. Yeah, they were ill, and most of them had high spiking temperature. Okay, yang kita tengok sekarang ni adalah spread daripada community kan? Yeah, yang kemungkinan because the surrounding people are vaccinated. Yeah, the degree yang adult tu dapat mungkin dia tak sangka dia dapat is less severe. And then itu yang kita harapkan. Kenapa kita suruh semua adult be vaccinated? Because you can protect you yourself, you get lesser. Then hopefully, if the child gets or other elderly ke dapat from you, they get it at the milder form. Yeah. The infectivity is the same. Kalau saya divaksinate pun saya dapat, saya punya infectivity kepada orang lain adalah sama dengan orang yang tak vaksinate. Maksudnya saya can infect
orang lain juga.
Orang lain saya protect diri saya, saya infect. Tapi kalau saya dapat COVID yang mild, harapannya saya pass the mild bug lah. Kan? Unless there's new variant. Unless there's new variant. Jadi soalan yang tadi tu, anak dah kena 2 kali, saya nak kasih damai lah sebab muntah. I will not say that's a good idea because we really don't know what more variant you can do, or maybe your daughter also can carry and pass to another kan. Bila kita jalan kat luar, kita tak tahu mana satu orang sebelah kita, orang yang dekat kita tu dia ada kanser ke, dia ada leukemia ke, dia on targeted therapy ke, dia not well ke ataupun dia lahir macam kanak-kanak, dia lahir dengan deficiency immune system. Okay, so kita again masa pandemic think about the rest, and of course kalau anak-anak nak keluar, maybe kita boleh keluar, bawa dia to somewhere yang isolated time. That's why saya selalu kata it will be good kalau dalam community tu kalau ada 20 rumah ke 30 rumahnya, kita take turn. Rumah A pergi main kat padang ni pada hari ni. You have to, kan? You have to live with that. You rotate lah. Macam juga bila buka sekolah ni, saranan saya kata the preparedness di sekolah tu, kelas 1, 2, 3 ke? Ni tempat kanak-kanak ni nak kena matahari. Kelas 4, 5, 6 dekat sini. You are allowed only 50 minit. Taklah macam dulu kan? Perlu basah kan? But at least you have to sit down and think about this and live it. So I can, that is preparedness. That is preparing for that day. And kalau kita nak sangat buka satu ni, kita buka lah. Macam kita buat kajian rintis, macam kita buat pilot study. Kita buka certain school and see whether this can work. Okay, and then test the system first. That's my suggestion lah. And of course kalau macam Perlis dah hijau, tak ada apa, they want to go full blown, they are the best place where we can do this test, opening the school and so forth. You know, I'm reminded, you know, macam Nadira MY ni, I'm reminded that macam di Sweden katakan, tak ada satu hari pun dia tutup sekolah. Daripada sejak COVID ni ada sampai sekarang, tak ada satu hari pun dia tutup sekolah. ya. And then di sekolah cikgu pun tak pakai mask, anak murid pun tak pakai mask. Can we replicate that here? Are we brave enough to do it here? Jawapannya no. Sebab di sana data-data yang saya cakap ni easily available. So they are in control. They know, you know, if I have the outbreak, I have this backup hospital with how many people are standing by, you know. And in fact, their latest data, they say, oh, we could have prevented 33 people from getting infected. Contoh dalam satu laporan itu, if they all wear mask, dia kata. So they even do, they follow the cohort and then they give improvement or suggestion to overcome. So saya rasa, you know, you want to buat 1 September tu, it scares a lot of people. It scares a lot of people because we are not clear of the level of preparedness at all this level yang saya sebut tadi.
Rasa macam geram pula doktor pasal kita tak cukup data information ni, padahal data scientist kita banyak, kenapa kita tak keluarkan the data kan. So we hope that, you know, maybe this is what parents we can do collectively, maybe on our social media, request for the data.
And work with the school, work with the teacher. Jangan kita, kalau kita we have to work together and lessen the argument. If you work together, cikgu saya ingat dan sekolah pun bagi tahu kan, I think we can have a more calm situation untuk start the sekolah tu buka. There could be ada sekolah yang dah bersedia tau Nadira, dia dah boleh jawab soalan-soalan kita ni. And sekolah is a good place kalau buka untuk bagi all these vitamins ke vitamin C pada kan, so all the kids can get kan, you know what I mean. Or you give susu datang sekolah tu, forced to eat sayur. Kalau kat rumah budak-budak tak nak makan sayur, pergi sekolah cikgu suruh je semua bersetuju kan.
Betul. I was also thinking of budak-budak yang maybe, you know, could not get you know, good enough food supplies and vitamins. Those who are deprived of that. The only place they can get is in school. So maybe I like your suggestion of opening in batches and trying out the apa nama ni, the rotation, bagi dulu yang mana yang perlu masuk dulu or something like that, you know.
In fact, kawasan yang PKPD ni Nadira Maini, saya rasa jangan berbokol dawai itu saja. You know, that is the one that you have to test and then treat, treat the adult, treat the children, okay, and that's the best because they are not going anywhere. So after that, you tell them, you know, you fall into this registry, we will follow up how healthy you are, and then because children are also exposed, maybe we can safely tell them, okay, you can't go to school yet, you know. So people feel reassured. I think we want that. Everybody wants that, kan?
Doktor, kita ni dah running out of time dah ni, tapi I nak minta jasa baik you lah pasal kita ada 3 soalan daripada participant kita yang I rasa
boleh.
Don't mind and participants, I know we promise you 1 hour, but if you like to stay with us, please continue. So 3 soalan daripada 3 ibu bapa yang ada kat sini. Maybe just your quick thoughts on variant Delta. Will variant Delta, is there enough information that shows that variant Delta memberi risiko yang lebih teruk kepada kanak-kanak bawah 18 tahun? Tidak, doktor?
At the moment tak ada data tu. Okay. In fact, data setahu saya memang kita assume that is the bila ada outbreak, I know KKM will test for the variant, and there's certain clusters code, and the best person to answer that will be the people in the position of power lah, But these are important kan, macam saya cakap tadi, saya pun nak tahu kategori mengikut umur, dan mengikut macam saya cakap tadi tu, preschool, sekolah rendah, sekolah menengah dan adakah varian yang kita tahu di tempat-tempat. Contohnya bila kluster tu tinggi, boleh tak kita kata kita dah test di situ memang ada Delta variant, please avoid. I think it's useful. Kan macam bila kita nak buka ni border ni, kita kata yang apa tu fasa 2 boleh pergi, but have we confirm that those areas tak ada variant Delta, katakan ya, these are valid question, you know, and it should be addressed. Kita tak boleh apa ni tidak menjawabnya ya, sebab implikasi dia besar kan. Kalau kita allow jalan, dia tengok, oh actually sorry lah, tempat tu tinggi kadar Delta variannya ya. Sebab kita pun tak tahu bila Delta varian ni hilang. Kita tahu dia airborne kan. Ada juga soalan yang tanya saya, doktor, diorang semua buka tingkap, lepas tu benda tu keluar, apa nak jadi spread lagi ya. Which is true, tapi the thing is kalau you tak buka the ventilation in your house, it will be more harmful to you ya, masa you quarantine ya.
Yeah. Okay,
Baik.
next question, if you don't mind, Doktor. Ni pasal asymptomatic ni, pasal tadi we mentioned about the child being asymptomatic, dia sendiri pun tak tahu bau dia macam mana, things like that kan. So asymptomatic ni, if we do the saliva test kan, so sekarang ni new norm ataupun the current norm is to have the test in our houses lah. But how effective is it to detect COVID in asymptomatic cases? Do we know whether effective or not?
Yeah. I think it's quite useful. Yeah. I think I have a batch of friends yang penggali kubur. I have a batch of friends yang, and when because they deal with, they are frontliners also. You must understand, these are frontliners. So don't call them backliners. Sebab dia meninggal, no, they are frontliners. So they are the ones yang bila dia rasa they are exposed a little bit more from the fluid ke apa benda ke, despite the preparation of the body they did that test. But as you can see, those yang didetect positif ikut kit tu disuruh juga buat swabbing kan, pergi ke sebab that is more definite kan.
Alright. Okay.
But it is a good screening, so you tak adalah tunggu your turn and then, because when you are positive there are precaution that you need to take kan. So the moment you get it positive, until you reconfirm the result semula, you take that precaution as a positive COVID.
If I can rephrase that kan, kalau orang tu asymptomatic, bila kita nak buat test tu, doktor? Ataupun we must make it a practice to test every month or every 2 weeks ke macam mana?
Well, the current thought di UK dia yang apa tu, there's two school of thought macam biasalah Dia yang kata stop it, don't mess apa ni test itulah you dapat tinggi tapi orang tak ada simptom. Ramai orang cakap itu kan. You know why? Because government cap, kalau certain ribu baru boleh keluar. That's why I said you can't do that. You have to stratify ikut the category, and you cannot every day say some goes up, goes down. You must tell, sebab contohnya you must what is it that you must tell? You must tell the critical situation, whether it's a critical situation or not. Apa maksud saya? Contohnya daripada peratusan yang tinggi yang kategori 1 and 2 tu. Lepas tu ada pula yang brought in date. Jadi kita nak tahu yang brought in date ni, adakah mereka ni daripada kategori 1 ataupun dia memang sebelum ni tak pernah ditest. It's important because if they are category 1 and we ask them to be quarantined and then now they are brought in date, that says the home quarantine fails. Okay, so this is critical. This is critical data ataupun saya nak cakap apa? Meaningful data. This is meaningful data. Data yang memberi makna. Jadi kita kena tahu data-data macam ni. Jadi bila kita kata dalam data saya dapati kan bila report tu ada naik ke tinggi, ada yang masih start. No, please tell. Kategori 1 ni didapati hari ini, follow up dibuat untuk semalam katakan mereka kekal di kategori 1. Mereka naik kategori 2. Mereka naik kategori 3. Baru kita boleh merancang kan? Because sama juga yang brought in date tu, is it because dia tak pernah, yang sekarang ni adakah dia tak pernah dikategorikan sebelum ni ataupun dia memang dari kategori 1 yang rapid ke tak rapid dia meninggal. Maybe kerajaan ada data tu. Tapi it's time that it has to be shared so that data yang begitu akan memberi, data yang bermakna ni memberi peluang kepada kementerian-kementerian lain untuk membuat percaturan ataupun perancangan, ya. Without meaningful data, data-data yang bermakna, agak sukar kita nak merancang. Itu pada penilaian saya lah, ya. What are other meaningful critical data, data-data yang bermakna, ya. Hari-hari tunjuk ICU berapa orang oksigen. Tapi a critical situation is when kita kata daripada ni kita dapati emergency department terpaksa naik daripada emergency department duduk 5 hari katakan. Sakit terpaksa menerima bantuan pernafasan di ward katakan. That shows critical. So the public knows, oh, this is critical. Kalau tak kita ICU memang macam tu. ICU is like that, you know. Tahun lepas pun macam tu. So percentage alone is not enough, to plan whether now kita bercakap pasal kanak-kanak, saya nak tahulah macam hospital kanak-kanak pun dah ambil untuk dak COVID kan. So macam mana, kat mana kanak-kanak ni letakkan, berapa bed yang bersedia untuk mereka sekarang, ya? Apakah peratusan harian kategori 1, adakah dia naik? Because we are talking about children now, kan?
Yeah,
so for me that is very important. I'm sure parents wants to know this, teachers wants to know this. So unless you know this, then it is not so nice when it's top down. Now you must buka certain tarikh,
Maybe kita boleh tanya parents and you all can respond dekat dalam chat tu lah. How do you feel about do you feel that you don't have enough data for you to make meaningful data for you to make decisions, ataupun you think what we have right now is sufficient for you to make your decision? So if you can share with us your thoughts, that would be great in the chat. Okay, one more question before we wrap it up. One more question. Pasal sekarang ni doktor, banyak sangat cerita pasal kenapa kita tak bagi Evomactin ni doktor dekat orang yang kena COVID ni kan. So in fact today I was reading in Washington Post pun ada recommendation of
Evomactin.
Evomactin and also ubat gout, because kebanyakan yang died from COVID was due to inflammation. So one of that was ubat gout. Of course, this is a study that's still doing lah in Washington. But Evomactin ni, somebody is asking, so what are your thoughts about using Evomactin for children? So adult pun kita tak settle kan. So your thoughts for children?
Okay, I follow. I'm a user of off-label drugs, and I've mentioned this before as a paediatric surgeon, and I lead the Paediatric Vascular Anomaly group, multidisciplinary pediatric vascular anomaly. These are children with abnormality to their vessel. It could be their lymphatic, their arterial supply, venous supply, capillary supply around the face, the body, in the brain, and so forth. Zaman-zaman dulu kita operate. Many years ago, quite significant, about 7 years ago, so there's an off-label use of sirolimus, which is actually a post-kidney transplant drug for adult, yang kita dapati useful for even pediatrics with vascular anomaly. So they the Cincinnati group in US draw up a protocol, then dan kita pun tertarik lah dengan dia punya report. Jadi bila kita nak gunakan off-label drug ni, kita ada institutional protocol dengan clinical guideline. Okay. So in my personal opinion, off-label drug ni is not something new. Tapi kita kena buat secara betul lah. So personally, I would think that there are a group of physicians worldwide di flccc.net. These are group of critical care physician. Dalam kita punya, and we must respect one another lah. Saya sebagai surgeon, yang saya terror macam mana pun, yang menjaga anak tu sebenarnya ICU, yang masa saya operate tu anak tu survive sebab anesthetic saya tu very good. Kemudian lepas tu bila anak tu masuk ICU, is the intensivist yang menjaga. So it's a group of us. It's a team effort. Okay. So we don't cakap we are better than they, tak ada. In the COVID situation, I think because it's a pandemic, we can have a meaningful discussion among physician to one another. This group dia critical care physician, maksudnya bukan calang-calang group lah. Dia dengan ada team director of evidence based medicine. We talk also in medicine ni. Tak usah nak ikut apa-apa kita nak, mesti evidence based. So this group is fantastic tau, yang promote Evomactin lah. Saya suka baca sebab saya rasa dalam keadaan pandemik ni kita tak boleh rasa kita saja yang betul. Okay? Tetapi saya juga tak setuju kalau kita allow public just go and get it and try. This is dangerous. Ubat tu safe sebab these are well tested drugs. Tetapi even the FLCC group dalam recommendation dia untuk children, dia syorkan use the supplement yang dikombainkan. Dalam protokol FLCCC tu dia bukannya bagi Evomactin begitu saja. Dia ada clinical practice guideline, dia ada bagi vitamin C, ada bagi vitamin D3,
Kids dia tu.
Jadi dia katakan untuk children begitu, Walaupun kalau kita tengok parasitic dos untuk parasitic dia kata don't give less than 15 kilogram in children untuk antiparasitik. Tapi untuk group yang promote Evomactin ni pun dia tidak sure Evomactin diberi kepada kanak-kanak. I think we should that is clear, kan?
Okay. Dah nak penutup ni, but ada lagi question just two more short ones. Okay, we want to summarize our session for today. So can you summarize, give tips for parents on how to help their children to strengthen their immune system? I know we touched a little bit on the pemakanan, on their diet, but as a whole, what else besides their diet? How can we help build and strengthen our children's immune system?
Also maybe doktor recap balik pasal ada parents yang tanya suplemen apa, vitamin apa yang kita nak patut bagi dekat children kita ni, just to recap.
You can recap lah, maybe some miss the session the earlier.
Okay. Dia macam ni, well balanced diet number one. Okay, so enough carbohydrate kena ada, protein ada, fat ada, Kemudian kita kena ada green veggie, okay? Kena ada fruits, kena ada vitamin C, okay? Ada yang nak tambah zinc, tetapi zinc ni dia ikut dos umur, so be careful. I would think kalau you nak anak tu increase boost, ikut fitrah anak-anak ni, they have to have enough sleep, good food, adequate food, enough sleep, enough play, and no stress. So anak yang a lot of parents substitute the playing dengan main di rumah saja, dalam main game dan sebagainya. This is actually, to be honest, not healthy, because you can get a lot of other digital related health threats. That's the forte of my team. When we are the team yang bekerjasama dengan Cybersecurity Malaysia, dengan NCW, looking at the digital health threats in children. They can damage their eye, damage their neck, if it is not appropriate, not well monitored. Terlampau lama tu menunduk saja, and boleh impair dia punya development also. Okay, so kena ada masa kat luar. Tu yang saya kata, macam mana nak letak kat luar kan? Kat luar mana? Kat balcony ke? How do we take turn to go out? Kalau rumah kita duduk banglo sebiji-biji, bolehlah main kat belakang rumah, tak ada masalah kan. Tapi kalau orang duduk dekat flat, Nak turun bawah macam mana? So I think community leaders kena find a way, maybe kena rotate, allow some time off. It's not playing like last time, but you need some natural vitamin D pun, and then how do you get vitamin A katakan? So some of the vitamins, multivitamins ke apa ni, are known to assist, and I know we are short of time. All I can say that I can advise you go to certain website. The one that I really like is the one from the Children's Hospital Group. Okay, so you can actually di US, di UK, Children's Hospital dia ada website untuk wellness. So these are monitored by pediatricians, pediatric dietitian, pediatric nutritionist. That is a more reliable reading lah. Sebab semua children hospital ni kita memang ada advocacy group, wellness group dia. So pergi ke sana dan baca cara untuk apa suplemen ke yang kita nak lah supaya kita tak over. Ada yang tanya probiotik okey ke doktor? Yes. Perlu ke saya bagi prebiotik dan sebagainya. So you can go there and the reliable website will come from the wellness subsite from a children's hospital. Itu nasihat saya.
Okay. And last one.
Ada lagi?
Ada. Last. I promise it's last. Last. Okay, what would you advise the things that each household should have? Macam contoh lah, Panadol, oximeter. What are the things that parents must have at home?
Okay, if you want to invest, you need air ionizer. Okay, if you want to invest, okay, if you have the money, you do that. Okay, air purifier. Of course, all houses must ada hand sanitizer, kena ada cukup mask. Saya sebenarnya risau sebab ramai ibu bapa yang tak mampu. Okay, kat tu saya kata masa PKPD tu bagilah semua kepada orang tu. Semua bantuan tu kena bagilah vitamin suplemen bagus. All houses mesti ada ni. Pakai mask ni tak boleh pakai. Kalau saya pakai mask, kalau cuba cakap kejap lagi air liur tu semua basah semua. Jadi bukan satu mask saja. Kalau kita ni macam cikgu-cikgu nanti nak mengajar, dia kena get used to it. It's not easy, you feel suffocated and you need to change. So how many masks do you need a day? In fact, the latest one from US sebab ada Delta variant ni, dia suruh kita pakai mask dalam rumah. Dalam rumah. Sebab you want to prevent further tapi kita tak ada, kerajaan kita belum begitu lagi. I think it's going to be very traumatic for a lot of people kan. Dah lah kena quarantine, lepas tu nak kena anak-anak mesti nak, lagi dia tak sihat lagi dia nak clingy to the mother kan, to the parents kan. So you have to keep yourself clean, you have to itulah ni kalau bagi banyak-banyak nanti semua rasa kekurangan di rumah masing-masing. Tak boleh.
Adalah, because I think moving forward we have to make this a lifestyle. I think everyone has to accept that we will be living with COVID. It's not going to go away.
Tadi
pulse oximeter is important. Temperature is important. Okay.
Thermometer.
Thermometer temperature reading. Kalau you nak pakai thermometer macam ni ke, yang macam imbas saja dahi ke. And you must remember you need to wash your clothes. Okay. So you need to get into the habit of changing. And tak boleh, and get into the habit of kita semua sekarang ni grab dan deliver. So get used to which hand is yang diguna untuk common, doorknob, then you have to wipe that as well. Walaupun kita tak ada standard of practice untuk tu.
So I nak tanya doktor, should we now have guns at home? Sanitizing guns. Should we have sanitizing guns at home now?
What do you mean? Sanitizing gun?
The machine tu, sanitizing tu. Spray.
We have that.
Tak payah. I haven't tried that bro, but you see aerosol ni, you kalau you positif kan you spray lagi. Dulu ada orang nak buat tunnel sprayer kan, dia nak buat tunnel, dia rasa oh orang lalu tunnel tu kita spray sembuh kasih semua. But actually it only can work if after you spray orang tu you have a vacuum system, sedut semua tu pergi somewhere kan.
Kalau
Tapi
tidak,
kalau
the
you
water
you lagi
Yeah.
jet out kan your viral load to others kan. So
juga tu.
yeah. Yeah.
Okay.
Okay, so we've come to the very end of our program for tonight. And I hope all the participants tonight, you've obtained some very useful information and advice. I hope that you find all the tips given by Dr. Dayang beneficial.
Nadira, UKM Children Hospital ni dia tak kita wellness group kita tak on lagi sebab kita
belum
kan
ada lagi.
dah dibagi pada adult kan.
Oh ya,
So-
daripada adult betul-betul. Okay, sorry, wrong information. Okay.
Okay, have I answered all?
Yeah. Okay, tapi sebelum tu, before we end, one more last thing. It's not a question. I need you to smile. Look at the camera and smile.
Oh, boleh.
Nak
Gambar
tangkap
ke?
gambar. Okay, 1, 2. Okay, we got that shot.
Okay, so thank you so much for the opportunity. I hope I
Thank
was
you
useful
so
tonight.
much bagi all the tips, petua, sharing semua. Harap-harap it will be beneficial for everyone.
Yeah.
Okay.
Thank you.
Moe, one last note to the participants. If you want more of such sharing programs ataupun you want us to bring in different experts, you want to talk about other things that worries you, please do send us an email ataupun just connect with us on our social media. We're on Instagram, on Facebook. We're very happy to take your comments so that we can organize some other things. Puan Nur Fazila, we're sorry we're at the end of the show. We cannot take your questions anymore, but kalau ada, then just send to us.
Okay, sorry, I was just informed by the staff that tak sempat tangkap gambar. So, Dr. Dayang, sorry one last time we have
I
to
can also help you. I can print screen for us.
Okay, let's smile.
Okay, thank you so much for inviting me, and I hope our sharing is useful for parents dan semua pendengar. Terima kasih. Baik, okay, senyum semua. Semua kita bertiga lah kan. Okay, 1, 2, 3. One more, 1. Okay, sekejap saya tutup chat ni, tutup muka Muhai ni. Okay, 1, 2, 3. Alright.
Okay, thank you so much, Dr. Dayang, for your time.
Thank you.
Thank you, everyone.
Alright. Thank you so much.
Had a good time. Good night. Assalamualaikum.
Right. Okay, Assalamualaikum warahmatullahi.